To bear a child who is that different is a tremendous load for a family to carry. To learn from the psychiatrist that this difference, this awful difference, may very well have been due to the way the child was nurtured, a disease of nurture, if you will, is quite an awful thing to carry. It generates an awful lot of guilt in loving parents.
It's interesting how the feelings about this disease have changed over the last century. When schizophrenia as a concept was first developed about 100 years ago, most of the investigators and physicians felt that it was a brain disease and were quite certain of it. No one could ever determine what that disease was made up of, and the research, such as it was at that time, was quite confusing. About 50 or 60 years ago, with the coming of psychoanalysis and the ideas about the power of the environment, it became an article of faith that schizophrenia was a disease due to the environment, and more specifically to the family orientation, the family interactions for the young person. I was taught this when I was in medical school, and in the few years that followed that, this is the basis on which we try to treat patients. And it was a very terrible time because we had no specific treatments, and the parents had to carry an enormous load of guilt, the possibility that they had made their child schizophrenic. As a matter of fact, a term that was in common use then was the schizophrenogenic mother, the mother who generates schizophrenia in her own youngster. And you know, parents have enough to be guilty about as they work to produce fine young people. To think that they had produced this devastating disease was a terrible load to carry.
At the turn of the century, every neuroscientist that was interested in schizophrenia was convinced that this was a brain disorder. There was no skepticism about that. It was only as that sort of stagnated and people really couldn't make much of the findings that they had at the turn of the century that people began to raise this notion of psychogenesis, that somehow either bad mothering caused schizophrenia, or that bad neighborhoods caused schizophrenia, or drugs, or some peculiar school experience, or some major psychic trauma of some kind caused schizophrenia, for which there's absolutely no scientific evidence whatsoever to this day.
In the last 30, 35 years, it's become increasingly clear that schizophrenia, the group of schizophrenias, are indeed organic diseases, and that one aspect of the schizophrenic reactions are genetically induced. The whole disease is unquestionably not a genetic phenomenon, because if you have identical twins, one of whom is schizophrenic, the other has only a 50% chance of being schizophrenic. So clearly, other factors are involved. We know that if there is a schizophrenic reaction somewhere in the family, sibling, parent, or even grandparent, then the young person has about a 10 to 12% chance of having the disease. And if there is no discernible disease in the family, then the incidence is about 1 or 1.5%. So quite clearly, it's a kind of final common denominator disease in which a number of factors, genetic, organic, developmental, and perhaps to some extent environmental, are all involved.
Dr. Scheibel and his colleagues have been studying the neurological basis of schizophrenia, focusing on the hippocampus and prefrontal cortex. The hippocampus is located in the temporal lobe region, deep within the brain. It plays an important role in memory, emotions, and moment-to-moment evaluations of real-world experiences.
With the coming of the major tranquilizing drugs, the neuroleptics, it became increasingly likely that there was a very strong chemical, molecular problem at the base of some schizophrenias. And that, of course, also pointed toward organic disease. We started to work in the area in the middle 1970s. And after doing work with a part of the brain known as the hippocampus at the base of the temporal lobes, we found that there are some very clear-cut organic pathological changes changes in the orientation or organization of the nerve cells. In most of us, you and me, the nerve cells are lined up very nicely like slats in a picket fence. In many schizophrenics, not in all of them, they're every which way like a fence that's fallen apart. As a matter of fact, I have here some illustrations which show quite clearly what the normal looks like as compared to the abnormal. We show the two patterns that we found in normal hippocampus and in the hippocampus of the schizophrenic patient. These are just two different methods of visualizing or staining the cells. Here we have normal cells. The cells are lined up very nicely, and their processes, which are called dendrites, are very, very nicely organized like slats in a picket fence. Here, the cells are all awry. They point in every which direction, and as a result, they're extensions. These dendrites also point in every which way. This must do rather drastic things to the connections. And since, again, it is the hippocampus which helps us, in a sense, appreciate and digest moment-to-moment reality, we can sort of infer that this must do some pretty remarkable things to the way the individual sees the world.